So being the advocate for the patient, or patient advocacy, I see lots of patients treating their spines, of course, and we see a lot of people from the East Coast. And I had the fortune of speaking to a highly intelligent young man, 30 years old, in Massachusetts, and he had gone to Boston, the big hospitals there, single level disc degeneration, and they want to fuse his back. And he had the intelligence to really look around and find out what were his options. So we created the Top Doctors Program, the ADR Spine Program, so you can find resources and doctors that are competent. Because if you fit certain parameters and you're a great artificial disc replacement candidate, find out. Find out before somebody fuses your back. It's sort of like having your hip fused. They used to fuse your hips back in the 1950s before the artificial hips came out. You would never do that. Well, the same applies to the spine, in my opinion.